My name is Dr. Evan Slack. I'm from Inline Health and Wellness in Fort Lauderdale, Florida. And my practice, we were first introduced to Dr. Dzugan about a year ago. And just the whole idea of Dr. Dzugan and what he represents made sense for not only myself, but our practice. Being a chiropractor, we've always believed in treating more of a holistic approach, or preventive, not treating symptoms, but looking at the cause. And just what Dr. Dzugan's approach and how he basically looks at the human body and the physiology, in optimizing physiology, it really just makes sense from so many levels. And speaking candidly myself, I've been on the program now because I said, before I introduced this to my practice, it has to make sense for me. That's just how I'm a believer. And since I've been on the program, I just feel better, my energy level, just everything, my skin, just overall I just feel like a different person. And I know with long-term effects of the program, I just know there's a lot of positive things that are going to come from it. And even the patients in my practice now, the ones that are on it, just we're seeing a lot of very, very good results. So I thank Dr. Dzugan because he's amazing.
I'm Dr. Les Ehof from Tallahassee, Florida, and I've been in family practice and geriatrics for over 30 years. And I was introduced to Dr. Dzugan and his method of optimizing physiology about 3 years ago. And I had been doing bioidentical hormones for at least 12 to 15 years prior to that. But this was the first program I saw that really incorporated all the hormones and really addressed all the physiologic imbalances in the system, and really had the potential of having massive improvement in my patients' health. And that has been exactly what has happened. Over the past 3 years, I have around 200 patients on the program, and I have been able to help people with problems that I could never help before, seen resolution of chronic problems like arthritis and asthma that constantly plagued people in the past, who now are no longer on medications for those problems and are just thrilled with the results of it. And it has been a godsend to my practice to be able to offer this to my patients and improve their health and resolve long-term problems.
I'm Ray Miller. I'm a family doctor in Perrysburg, Ohio for the last 25 years, and I've been working with Dr. Dzugan, taking care of patients for over 1 year. My patients are extremely happy with the results. They feel better, they look better, they are better. We've treated multiple conditions using Dr. Dzugan, and he's been very helpful in educating me and my patients into his restorative medicine protocols.
Hi, I'm Dr. José Roberto Araújo Lima. I'm Brazilian. I'm doing the Dzugan program about 2 years, and now I feel good, very good. I have a lot of health and energy. I recommend this program to all people that want feel like me and have health and energy.
My name is Dipnirain Maharaj. I'm a hematologist-oncologist and bone marrow stem cell transplant physician. I'm very pleased to be here at the IPOMS conference in Cancun, Mexico, and also very pleased to be invited by Dr. Dzugan. Dr. Dzugan is a world-renowned scientist and physician and cardiac surgeon, and has impressed me immensely with his physiological approach to treatment of diseases. I've enjoyed listening to his lectures and also the practical aspects of seeing the work that he does. He has also talked about the optimization of stem cells using physiological means, and I believe that this is the approach that should be taken for individuals who are looking to improve their health. As one of the founding members of the IPOMS, this first meeting has been a great success, and we look forward to future meetings and having as many attendees as possible attend the conferences. Thank you for the opportunity of being able to work with Dr. Dzugan and all the other members of IPOMS. Thank you.
Hello, my name is Peter Hyduk. I came from Czech Republic, from Praha. I am a physician. I'm working in a regenerative clinic, Aura Clinic in Praha, and I'm in a program which followed Dr. Dzugan's approach for about a year. We also already have about 50 patients follow the program, and myself and my family are following the program as well. And I must say that since we started, I improved for myself, my feeling, and our patients, mostly about 50 years of age, are getting very excited about the results by optimization of their health.
Hi, I'm Dr. Jim Hayes. I'm board certified in family medicine and emergency medicine. Started my practice approximately 25 years ago, read the book Prevention, and realized that my allopathic training was not enough to really treat the cause of illness rather than just the symptoms. And so I started using natural products, and throughout my practice did that, was criticized, but found out that patients got better. And so I've always been very knowledgeable and interested in nutraceuticals. But when it came to last 4 years, I met Dr. Dzugan, and I realized some of the challenges I was having with the stress that I was under in emergency medicine and other reasons, and started developing some fatigue and a little increased girth around my belly or visceral fat. He did some blood tests and then found out that it showed some early symptoms of aging, quote unquote. So I went on his recommendations with another doctor, Dr. Ehof, and within 6 months or so I got back to running, came down to ideal body weight, functions normalized, and the energy level is tremendous.
Hi, my name is Kathleen, and I'm a registered nurse and specializing in the area of nutrition. I have always been very focused on my health as far as eating foods that are healthy, but also taking supplements in order to take care of any depletions I may have. But I found I got to a point in my 40s where, despite my healthy lifestyle, I was starting to feel fatigued, not myself. I started seeing changes in my skin, in many respects the normal aging type symptoms. However, that wasn't acceptable to me. So I found that it was very difficult to find a physician in the area that I'm in that was adequately educated on bioidentical hormone replacement. I had visited several other physicians in the area, and of course their approach was more the drug model, and their advice was to take pharmaceutical medication, which I was not agreeing to do. So I did locate, after interviewing and speaking to many other programs that claimed to do the same thing, I came across the Dzugan program and found that not only were they educated in areas like nutrition and supplementation, but also very advanced in the field of bioidentical hormone replacement. So I started their program approximately a year ago, and experienced results very early on, within a month to 2 months into the program, and it only continued to progress in a positive manner. Also, what I found was it really complemented my personal program of health and nutrition and exercise, and supported that whole concept. So I felt very comfortable with the Dzugan program.
Hello, my name is Florence, and I was very fortunate to learn about the Dzugan method thanks to Mr. Sutton and Julie. And you know, at that phase of my life, when I heard about the Dzugan method, I was going through menopause disorders. I was, you know, waking up every hour throughout the night. I didn't have the energy to go to the gym. I had cravings for sugar. So I decided that if I kept up, I had terrible mood swings. And I figured if I kept this up, I was going to be ill. Because I didn't have any type of illness, just, lack of sleep, excessive candy eating, etc. So I decided to go on the program. 5 days after I started the program, I realized that it was an excellent program because for the first time in 10 years, I slept the whole night through. So, and from there on, I felt much better. I have more energy. I go to the gym, things that I couldn't get myself to do. I don't procrastinate anymore. So, to prevent, don't wait till you're ill. You want to prevent, you want a good quality of life. Join the Dzugan program.
My name is Peter Hyduk. I live in Denver, Colorado. I met Dr. Dzugan in 2009 and decided to go into the Dzugan program. I was a healthy male, over 60, not really having any problems, but his program sounded so interesting that I decided my wife and I would try it. My wife was postmenopausal, had some problems from that. And the biggest problem I had was I would get up in the middle of the night. And you get into my age group, one of the problems that you have as a male is you get up in the middle of the night. And sometimes you get up more than one time. The first thing that I noticed about being on the Dzugan program was that after about 2 weeks, I didn't get up. I got up at 6 o'clock, went to the bathroom, and that was it. So for me, just from that fact, this program is worth that. I've had a lot of other positive things that happened. My skin's improved, my hair has gotten thicker, and I'm a lot more physically active. My mind is sharper, and I feel really like I'm at least 10 years younger than I was. So to me, it's been a very positive experience, something that I'm going to continue to do until the day I die. And I really thank Dr. Dzugan for all his help, all his insight, and this is a very exciting program, I think, and anyone that's over 50 should really consider doing this. It's been a great help.
So, my name is Jim Mathias. Came onto the program just around April or May of 2011. Interesting enough, when I had done my blood work, my blood panels for preparation to come onto the program, there was a small notice and it said at high risk for a heart attack. I really dismissed it and I thought, okay, it's blood work, it's science. Well, lo and behold, on June 10th of 2011, I actually suffered a 100% blockage in my right coronary artery. Just scared the heck out of me. Fortunately, I had been on the program for about a month or so, and later came to find out that a lot of the vitamin E was what really kind of allowed me to kind of survive and heal through my heart attack. I'm a 40-year-old male. I just feel rejuvenated. Been on the program now since April. We're into January of 2011. So I've been on the program just about 8 or 9 months. Weight loss, I've lost about 32 pounds. And I'd say that the program has not just physically helped me from the physiological perspective, but I think just also from a mental perspective. I think it affords you that secondary reinforcement to say, okay, I'm not trying to do this on my own, that I've got, millennia of science and proven practice behind what it is I'm trying to do for myself. I was on a statin for a period of time, just following contemporary science today, was on it, and I just felt like I was walking through mud. So I was talking to a bunch of different individuals, other friends of mine that had heart attack, and we were all talking, just kind of exchanging stories, and we all had the same symptoms. Just that those statins were just really making us tired, and just the side effect was far outweighing any benefit to us. I personally stopped taking my statins probably about 4 months ago, and I just feel fantastic. My cholesterol levels are fine, and I continue on with my program. Today I just feel blessed that the methodology came into my life, and that physiology for me now is just a practice. It's just something that I placed into my life, and it's just a new behavior that I have. And I just feel real fortunate to have come across Dr. Dzugan and his theories and his practices.
And when I saw my father going through all these significant improvements, and Dr. Dzugan approached me and said, you know, what we want to do is we want to try to get this message out. We want to try to educate as many physicians as we can. We want to try to educate as many people as we can with this. This is the way that medicine was intended to be, prevention first. And then if we need the conventional route, we'll go that way. But let's focus on this first. And I just believed it. And I couldn't believe that the medical community just completely missed this. So I just, about 3.5, 4 years ago, I've just dedicated my life being so grateful for how it's benefited my father and benefited other people that I know that have enrolled in the program because of my father, because of me. I've just made it a personal mission to help get involved and try to make this a part of mainstream medicine or health. And I started on the program myself about 2.5 years ago, and at that time I was about 283 pounds. And right now I've lost close to 60 pounds. I feel night and day different. I played football in college. I played football my entire life, and sports and wrestled. And my wife saw me get out of bed. I remember the first week we were married 7 years ago. She looks at me and goes, "Oh my God." She goes, "I saw you get out of bed. It was like an 80-year-old man." And my hair was a lot thinner than it currently was. Just my mental acuity, my anxiety was through the roof because of the stresses of business and everything. And I feel 100% just a completely different person. And like I said, I'm down 60 pounds, but my mental acuity, anxiety, I'm really able to handle a lot of pressure situations and control my emotions and feelings. But what really jarred me is about 3 years ago, Dr. Dzugan grabbed me and he goes, "Michael," he goes, "look at your father and look at the improvements he's made." He goes, "You're headed down that same path. Is this what you want for your life?" He goes, "You not only look like your father on the outside, but you look like him on the inside." And he said, this isn't what I want for you, and I know it's not what you want for yourself." And man, that scared me, because someone at that time, I was 28 years old, thinking that you don't need anything like this. Who needs to worry about preventative health measures at 28 years old? But it resonated, and I went and got my blood work done, my medical history. He presented the labs to me in front of me, and he goes, "Look, look, 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 look," and correlated it all to my father. And he goes, "That's your destiny. You make a decision for yourself." And it's the best decision that I've ever made for myself and my health. And of course, I'm just so grateful, and I've just dedicated myself and my being and everything I have to letting the world know that this exists, and there's other ways to look at health and medicine. So I want to give a special thank you to Mr. Richard Sutton, Julie Sutton, and Royal Resorts for inviting us to come and speak throughout the year. It's just been a tremendous opportunity for us to educate people and inform them that there's other ways to look at health. So thank you very much.